going here. Okay, so it's on. Okay. Hello. Hi. Delegate Young here from the Maryland General Assembly, District 44B, and chair of the Baltimore County delegation. How you doing? There's been a lot going on in the last couple weeks. So, as I'm sure you're aware, the coronavirus has been spreading, and local governments have been taking appropriate actions to prevent its spread and keep citizens safe. And even here, we have been doing our part. We've sent all of our staffs home, and it's been it's been about 3 hours, and I think we're doing good. Yeah, we're doing good. So you all may not be aware that we have a number of doctors in the House and the Senate. So I thought it'd be a great idea to bring them in to answer some questions about the virus, about where we are so far, how you all can stay safe and healthy. So without further ado, Dr. Clarence Lamb, welcome.
Hi, it's a pleasure to be here, Delegate.
Doctor.
We should do this.
And Dr. Terri Hill.
Hi, Senator.
Hi, Delegate. Doctor.
Doctor.
And Dr. Lorig Charkoudian, welcome.
Hello, Delegate, Doctor.
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 And we also have Dr. Michele Guyton.
Great to be here, Delegate, Doctor, Doctor,
Doctor.
Doctor,
Doctor. Doctor. Doctor.
Doctor.
Doctor,
Delegate.
Delegate.
Doctors. Well, let's move some of this stuff around here. Somebody grab the sword.
The sword.
Dr. Guyton, maybe you could share with the folks at home a little bit about the virus, who's being affected right now, and what we can do to prepare.
Well, I'm actually a PhD in psychology, but it can be very frightening to be in the middle of a pandemic, and we should really all be very much in touch with our feelings. But maybe Dr. Charkoudian can help us out.
Well, yes, actually I have a PhD in economics, but we could talk about the markets and the impacts on the markets, or maybe Dr. Hill could help us.
So, doctors, Dr. Hill, maybe you could tell us a little bit about the virus, what we can do to kind of help prevent catching it spreading.
Okay, well, Delegate, the rule of the day is social distance.
Let's do that.
Okay, that's better.
That's a little better.
That's a little better.
More comfortable now.
Yeah. So, the usual sanitation things that we've always been told to do but we ignore. Hand washing, 20 seconds, soap and water, or if you don't have the soap and water, sanitizer, a good rub, always, frequently.
And that's just good information or good advice during regular flu season as well.
Absolutely.
Gotcha. Is there anything, I think folks do kind of confuse the fact that this is different from the flu. There's some misinformation going around, and it's important to identify legitimate sources of information. Who would you suggest, or where would you suggest folks go to get that information? Dr. Lane?
So the CDC has a lot of good information. They have guidelines for patients, they have guidelines for physicians and other healthcare professionals. I think there's a lot of solid information on there. There's also some more local information from the Maryland Department of Health. They have a website that's updated daily with the latest information about what's taking place here in the state.
Gotcha. And we'll have links to those at the bottom of this video as well, so folks can go ahead and take a look at those. So the folks at home, I think everyone, this is the first time that we're dealing with anything like this. And as medical professionals, I'm sure that there's been a training involved with your education about what folks should do, not just about preventing the spread, but just to prepare now that we're in one. Any advice that could benefit the folks at home?
I think the most important thing is to actually stay up to date with what not only the CDC is saying, the Maryland Department of Health, but also with your local Department of Health is saying, and follow along with the advisory. So if they're saying that they don't want you to go out into crowds, try and stay away from crowds, because it's not just your individual health that's at stake, it's the health of the entire community.
Mm-hmm.
And it's also important to plan and prepare. I think a lot of families do need to take a look at and have discussions with each other about how they can prepare for instances where they may need to isolate themselves for 2 weeks. How would you actually go about doing that? do they have enough food to be able to stay at home for that 2-week period? And also plan for any instances where they can work remotely, so telework plans, or making sure that they have the latest software that they need to be able to work remotely. All of that's important for social distancing as well.
And I would add one other thing, that it's also important that we recognize that we're a community. And so it's important to prepare your home for a 2-week or longer period of quarantine or isolation. But it's also important to try to make sure that neighbors, particularly elderly neighbors who may not get out, are cared for as well. And so if that means that you're checking in with a neighbor when you go to this grocery store to make sure that they get food and supplies as well, then that's what we should be doing.
Hey, Cole. It's Delegate Young. How are you?
Hey, boss. You doing all right?
Yeah, no, yeah, fine. All good things, How are you?
Oh, good. I was worried for a minute that you were going to tell me that the office was a complete mess and that you stacked up the annotated code on your desk.
Yeah. Anyway, you know when I have a document and then I need like another one of that same document?
A copy?
Yep, copy. And then you go to the machine to then get that other copy in the hallway.
The copier?
Yes, the copier. And you gotta, what do you put in to the machine to get the document out? What is that?
Paper?
There you go. Where is that? Where's the paper? Good evening. I wanted to take a moment to use this platform to address the rapidly changing situation across the nation and the world. I had a number of people reach out and ask if I could release another Fireside Chat to lift everyone's spirits. And I tell you, I've put a lot of thought into these videos that we've released, but I've never thought of them as a source of relief from the frustrating, chaotic, rewarding, and important work that we, the advocates, lobbyists, and the public do. Thank you for your work, and thank you for watching. We're going to get through this. There is much uncertainty and many unknowns, but this too, in time, will pass. In the coming weeks and months, our resolve and sense of community will be tested. And fear is natural. There is no shame in it. Courage isn't measured by a lack of fear, but by pushing forward and doing what must be done, even if you are afraid. When this crisis ends, we will look back and remember the good and the bad. Instances that we wish we could have done better collectively, and those that will live on as inspiring examples of who we are and what it means to be a free people. Leaders will emerge, and new heroes will rise. Our job now is to decide how we will remember our response to this event. Individualistic and afraid, or courageous in our care for our neighbors, and reinvigorating the common sense of American fraternity that transcends political, cultural, and racial differences. To all of you, stay safe, stay prepared, stay well. We will see you soon.